The first 5 symptoms of tongue cancer. Tongue cancer, technically known as oral or oropharyngeal cancer, is one of the most common cancers. That's why it's crucial to know the symptoms of tongue cancer in order to treat it as early as possible. In most cases, people with tongue cancer were lifelong smokers or drinkers. The statistics indicate that it appears in men more than women, and lately, the number of people with oral or oropharyngeal cancer has risen. As with any disease, there are certain symptoms that appear that are indications of what is going on. If you suspect tongue cancer, these are some of first 5 symptoms of the disease. However, please note that these symptoms are the most general ones and are not 100% indicative that you have cancer. If you have any health issues, remember that you should see your doctor to get checked out and to get properly diagnosed. Risk factors. Just like how people with a family history of diabetes are more likely to have diabetes sometime in their life, there are also factors, whether lifestyle or diet-related, that can make you more likely to get tongue cancer. Some of them are: smoking and consuming alcohol. This combination makes you more likely to get tongue cancer as well as other diseases like lung cancer, cirrhosis, and stomach cancer. Active smokers are more likely to grow cancerous cells in the oral area. This is also true for people who regularly drink alcohol. Eating a diet low in fruit and vegetables weakens your immune system and makes you more vulnerable to frequent health problems. Human papillomavirus, HPV. People with HPV are more likely to get tongue cancer because the virus is directly linked to its appearance and growth. Symptoms of tongue cancer. Tongue ulcers. Painful ulcers or sores that do not respond well to medication are one of the first symptoms of oral or tongue cancer. Normally, ulcers are painful and very uncomfortable. However, the difference here is that these are much more sensitive and appear very frequently. It's important not to confuse them with normal ulcers or oral herpes, so pay attention to the level and duration of the pain. Pain. The pain caused by tongue cancer is not limited to just the tongue. It may also extend throughout the mouth and throat. You may feel it during everyday activities like drinking liquids or chewing food. Depending on the pain while swallowing or chewing, this may be an indication of cancer, though it may also be attributed to throat infections, tonsillitis, or an allergy. Pay close attention to the intensity and duration of the pain. If it lasts longer than a week and you see other symptoms like spots on your tongue, it's best to get examined by a doctor and properly diagnosed. Spots on your tongue. Spots are another big indication that you may have tongue cancer. They are usually white, leukoplakia, or red, erythroplakia, and last longer than 2 weeks. If this is you, you should see a doctor to find out what's going on. If your doctor decides it's necessary, she will order a biopsy to analyze the spots. Unpleasant odor. Having a bad odor in your mouth after the above symptoms is very common. It can be fixed by brushing your teeth and tongue, but it will come back and may come along with a bloody taste. Bleeding tongue. Many people with bleeding in the tongue area and confuse it with bleeding gums or ulcers. That's why finding out where the bleeding is coming from is important. Clean your tongue after eating with a cotton ball to figure out where it's coming from. See a doctor if you constantly taste blood in your mouth.